A healthy human heart works tirelessly. In an average lifetime, the heart can beat more than 2.5 billion times without ever pausing to rest. Like a pumping machine, the heart provides the power needed for life, so when problems occur, it can be deadly. One such problem is aortic stenosis. Due to calcium buildup, the aortic valve narrows and the heart must work harder to push blood to the rest of the body. Eventually, the heart gets weaker and cannot pump enough blood to the body. In fact, people who have developed symptoms from severe aortic stenosis and who go untreated have only about a 50% chance of living 2 years.
The primary cause of aortic stenosis is really aging and calcification of the valve. So the valve normally is very thin and opens widely. As calcium builds up, now that valve doesn't open very well. It's very thickened. The symptoms of aortic stenosis include, first of all, shortness of breath. Not being able to do what you did maybe 6 months ago, go upstairs. Now, geez, short of breath, or used to be able to mow the lawn. This year you can't mow the lawn. Sometimes you're short of breath, you have to sit up at night. You can't lay down in bed. Another symptom is having chest discomfort. That's new, particularly with activity. Also dizziness. Sometimes patients will actually faint and lose consciousness. I'd say the one thing about this is often these symptoms are just mistaken for getting older. This is a disease of the elderly, and this shortness of breath and the fatigue just often is attributed to I'm getting older. But in fact, that shortness of breath that now you can't garden, or that fatigue that you just can't do what you used to do, is due to the really dysfunction related to the aortic stenosis. So aortic stenosis is probably the most lethal of cardiovascular diseases. The average lifespan in somebody that gets severe and symptomatic aortic stenosis is only 2 years. It's almost like having a malignancy that's metastatic. It's very serious. And so they really need to get appropriate evaluation, have a referral to a cardiology or a heart team where they're able to evaluate them and really explore all the options that are available.
Treatment for aortic stenosis depends on how far the disease has progressed. If the stenosis is mild, medication may be prescribed for temporary symptom relief. However, if your stenosis and symptoms worsen, your doctor may recommend replacing the valve, which is the only effective treatment for severe aortic stenosis.
If you're a patient who needs their aortic valve replaced and you present to our valve team, our first analysis is whether you're a candidate for conventional surgery. For those patients who are relatively healthy, the procedure is low or medium risk. We proceed in that manner. We have lots of surgical options, small incisions, minimally invasive techniques that can do it very well and very safely. If the heart team deems that you're higher risk, you have more medical problems, maybe you're older and have mobility issues, etc., that make the surgery high risk or prohibitive, then we would consider transcatheter valve replacement, or TAVR, as a viable option in replacement of your aortic valve. So for a patient to understand what their best options are, and they can be multiple, you really need to discuss it at length with a heart team that's dedicated to treating valvular heart disease and really help you work through all the issues and come to a very good understanding of what you need.
For people who have been diagnosed with severe aortic stenosis and who are considered high risk or too sick for open heart surgery, transcatheter aortic valve replacement, or TAVR, may be a viable option.
Transcatheter valve replacement, or TAVR, is a less invasive way to replace the aortic valve. And what we do is through a tube or a catheter, often really threaded up from the groin to the heart, we're able to put a valve that's crimped down on a balloon inside that catheter, then place that balloon with the valve in it inside the native valve, or the valve that the patient was born with, and then inflate that balloon, and the valve comes up and basically wallpapers the inside of the old valve, moves those old disease leaflets out of the way, and allow the new leaflets to begin to function.
Today, there are more options than ever before to treat heart valve disease. Patients should consult a heart team if they have severe aortic stenosis. The TAVR procedure is a major medical advancement. Patients who cannot undergo open heart surgery now have an alternative treatment option for replacing their aortic valve. Talk to your doctor and consult a heart team to see if TAVR is right for you.